Hello, everyone, and welcome. Today's guest launched the Whole Health Medicine Institute to train medical professionals about mind-body medicine. She's also an author of several books, including Mind Over Medicine, with a new one coming out very soon that we'll talk about later. Let's welcome Lissa Rankin. Hi, thank you for being with us.
Hi, Jenna. I'm happy to be here. Thank you.
So your whole thing is mind-body medicine. How do you explain this to Middle America?
Well, mind-body medicine is sort of an overused term at this point. I think it's been used since the early 70s to talk about the connection between the mind and the body. The most sort of rational way to understand it is that every cell in the body is affected by hormones that are secreted based on thoughts, feelings, and beliefs that originate in the mind. So they're not disconnected. Our thoughts, feelings, and beliefs affect our body, but a lot of what I teach about really is sort of bringing spirit back into medicine as well. So it's really sort of a mind, body, spirit approach of, using illness as an opportunity for awakening. And because I work a lot with healthcare providers, it's about really being that vessel for support, for nurturing care when someone's going through a health crisis, and being able to bring spirit through in that way in order to facilitate the body's natural self-healing mechanisms in our patients.
That makes me so excited to hear. I think I have a personal connection with believing that the mind is in every cell of the body, so how you think affects how those cells react.
Right.
And my mother is from an older generation, and I'm trying to convince her of that. And I don't know how to explain it to her to get her to understand that connection as well. So, do you see this a generational difference?
Well, it's funny because I come from such a conventional Western medical background that for me it's not generational. I was like your mother until I sort of had an epiphany. But if you want help explaining to your mother, I can give you a little quick tutorial on the science behind it, because sometimes that's what the cognitive mind needs is a scientific explanation.
Yeah.
But what happens is that the mind has a part of the brain in the limbic system called the amygdala. And this part of the brain is constantly on the lookout for danger. And whenever, so if you have a tiger running after you, for example, right, the amygdala is going to signal danger, and it's going to put the nervous system in fight or flight response, right? This is the stress response, or the sympathetic nervous system. Now, the body has natural self-repair mechanisms, and we know this. We're taught this in medical school. So the body knows how to, fight cancer cells that we make every day. It knows how to keep us from getting infectious diseases, even though we're exposed to bacteria and viruses every day. The problem is that those natural self-healing mechanisms only operate when the stress response is turned off. So there's another state of the nervous system, the parasympathetic nervous system, or what Herbert Benson at Harvard called the relaxation response. And when the body is in relaxation response, it's the homeostatic state. So the body's natural self-repair mechanisms can get to work and do their job. The problem is that the amygdala can't tell the difference between there's a tiger on the loose or thoughts, feelings, and beliefs like nobody loves me.
Stress is stress.
Or I'm afraid, or I hate my job. All of these daily stressors. So the problem is our bodies are in chronic repetitive stress response. Studies show that we're in stress response more than 50 times per day. And every time we're in stress response, the natural self-repair mechanisms get flipped off. So the mind and body are integrally linked in this way, in that when we can relax the nervous system by reducing stress responses in the body and activating that parasympathetic nervous system, then the body can do what it does best, which is heal itself. But in order to do this, we have to treat not just the physical health of the body, but we have to recognize the importance of our relationships on our health, of our jobs on our health, of our environment, and our creative lives, and our sex lives, and our spiritual lives, and our mental health. And all of these things affect the amygdala, which thereby affects the hormonal milieu of all of the cells in the body. So to think that the mind and body are split is it's very elementary. And of course, spirit is infused through all of that. And so when we bring all of that together, then we really do make the body ripe for miracles.
So you are on a crusade to heal our healthcare system with this message. What's your plan, and how are you doing this?
Well, it's hard because I was called to medicine at the age of 7, the way priests are called to the priesthood. I mean, it really is a spiritual calling for me, and most of the doctors that I know have similar stories. And yet we wind up in a system where we're being asked to betray our integrity. And a lot of this is just the nature of the system. It's easy to think of ourselves as victims of the system, right? We're victims of the pharmaceutical industry or the managed care the managed care health insurance industry, or the lawyers or the politicians. We like to blame other people. But what I'm trying to train the doctors in the Whole Health Medicine Institute about, and now we're opening it up to other healthcare providers, I'm training them to reclaim our profession. This belongs to us. We're not victims of our system. We have let this happen. So I really think it starts at the grassroots level. It starts at reclaiming the healer-patient relationship, and it's about remembering what it means to be a true healer, which is not just about prescribing drugs or performing surgeries. Those things are important, and there's nothing about my message that is denouncing Western medicine. But I think we have to go further. I think when we can combine Western medicine with love, with nurturing care, with remembering what it means to be called as a healer, then we can be part of that force of activating those relaxation responses in our patients that allow their bodies to optimize the state of their health. So it's really about helping both doctors and patients and other healthcare providers, health coaches. It's about helping us remember who we are. Patients have to remember to claim their own power, because they've been trained in learned helplessness, what Martin Seligman calls learned helplessness. They give their power away. And they've forgotten that their intuition is incredibly important in the healing relationship. And that, we know our bodies better than anybody else, even if somebody else went to school for 12 years. So it's both. It's both the patient needs to step up and reclaim their power, and the healthcare provider needs to show up from that place of love to hold the container for the patient to have that healing experience. And when we do that, from that grassroots level, one healer-patient relationship at a time, then Washington's going to have to respond. Then it's going to affect those outer systems. Then the insurance companies and the pharmaceutical industry, we're going to be fueled from the inside to reclaim what belongs to us in order to have the ripple effect on these other things. I don't think it can come from the top. We have to come and rise up.
I feel so enlightened, and just your energy being here is such a treat. So thank you for joining us.
Thank you. It's a pleasure. Thank you all.
All right, everyone, if you would like to listen to more interviews with Integrative Nutrition's visiting teachers, please subscribe, and thanks for watching.
The amount of exposure then that we're each having to GMO soy and corn is, I think, a lot greater than anybody thinks. It's not that corn on the cob that you're eating in the summer.
It's the hidden ingredients.
It's all the hidden ingredients. And by trying to take it out of your diet, it's the single best way to begin to learn to eat a whole foods diet.